Thanks very much, Grania. Hi, everyone. So yes, I'm a bit of a last-minute parachutey in, but and I'm stepping into Mary's shoes here. So, but I'm delighted to be here with you today, and it has flown today. I was busy taking notes over there, and you know the way people were talking about coming up with a kind of a summary of information, a massive amount of information in a half page in a nano time frame. Well, I was feeling the pressure over there, all right, sweating this. But I did it old school. I did not use ChatGPT. So this is from my brain. So yeah, today we were talking about advancing evidence-informed policy for health and social care in Ireland. And I suppose as a journalist who's been writing about health, innovation and science for the last 20 years in Ireland, it's a theme that I have seen emerge and grow hugely, and it's a very welcome one. I think, you know, at some stages in our history, we kind of looked at research through the lens of what kind of jobs can it create, what kind of economic benefit it can create, and that's really important. But I think we've now moved to expand it to see what can research do for society, and one of the key interfaces or areas where we see that is how evidence can inform policy. And the HRB has been a huge driver of discussions and practice in this area, and today really has been a fascinating overview of some of the developments in Ireland and internationally. Also, this morning coming in on the bus, I could not, I would have stood up and said, I don't know what a RESA is, but I could potentially explain it to somebody when I'm going home on the bus. So that's a result for sure. And before we go into the final discussion about what we've learned from here, I just kind of want to take a moment to recap what we've been talking about today. And as Grania put it earlier, evidence for policy, it does kind of roll off the tongue, but it's very complex in practice. And we've heard about everything from kitchen upgrades to elephants to bicycles and Formula One to help put us in the picture. And of course, something that came through for me a lot really was hearing about the strengths and weaknesses of that informal network that kept getting mentioned, and which, as Stefan described it, it's the privilege and curse of a smaller country. So I'm sure we'll dig into that in the Q&A. But going back to our first session, which was called Evidence-Informed Policymaking and the Need for a Fit-for-Purpose Evidence Ecosystem, which was ably chaired by Barry. And I hope Hodges Figgis has that handbook in stock now for everybody who wants it. Dr. Fergal Lynch spoke of the pillars, evidence, feasibility and legitimacy that underpin policy development, and how many forces and pressures come to bear on that policy development cycle, and the need to balance those with kind of a cool and objective head, and the creative tensions that can arise between policymakers and researchers, and that uncertainty absorption as well, where perhaps a policy option is being oversold, whether wittingly or unwittingly. And I think although he made the argument that all those and many more pressures mean that we actually do need evidence to underpin policy. It's really, really a key pillar. Dr. John Lavis described the features of an effective evidence ecosystem, where the ideal could be that the policymaker identifies a compelling problem, gets the relevant data within a day or two, and delivers a meaningful summary as a half-page note to the relevant minister, which sounds absolutely great. And John spoke of it like a well-functioning kitchen building project, where you have a good client, lots of responsive trades, so they're the researchers working in a coordinated way to deliver what's needed, and a contractor who makes sure it all happens on time. And he also spoke, as others did too, about the many different types of evidence, and how individuals or units can coordinate responses in a well-oiled machine that can deliver different grades of reports across different timelines, to make up the various parts of the elephant, as it were. And also, being very honest, John did say that, you know, having a coalition of the willing is not always enough to create and strengthen this kind of system, that other political priorities and pressures can come to bear as well. There's more work to do. Then Leonora Harty talked about the work that's been done to map out the systems and frameworks for evidence to support policy in Ireland. Turns out we have a few, including the Civil Service Research Network, which has been a game changer in bringing research leads together to talk about activities and sharing good practices in that forum. Leonora also spoke about what people in the evidence for policy sphere feel they need based on research. So more time for research, fora for communicating, access to data, for researchers, a better understanding understanding of that policy development cycle and how to plug into it, better incentives and centralised mechanisms. That's another theme that kept coming through today. But taking the broader view, Ireland is moving in a good direction and building a lot of links with EU networks and projects. In session 2, which was evidence-informed policy making, what works and where are the gaps, which was chaired by Dr. Teresa Cunningham, Dr. Barbara Whelan spoke about the RESA project, and findings on strengths and gaps in the evidence ecosystem for health policy making in Ireland. And Barbara spoke about, on the demand side, we're growing the culture and capacity for evidence-informed policy making, but there can be a lack of time and skills and too much reliance on those informal networks. On the supply side, we have good quality evidence and partnerships, and there are some structured pathways like the HRB Evidence Centre and the HRB Evidence for Policy programme. But again, there's a lack of central tracking, and the system can't really tell if the policies are delivering yet. And at the interface then between the two, we have great advisory groups, expert groups, and knowledge brokering and conference events. But again, there's that over-reliance on the informal contacts, and the system currently works mostly because of people rather than process. And Barbara had several recommendations and even kind of timeline, realisable things over timelines that can happen quite quickly, including a central repository and an evidence synthesis hub. We also heard about 2 case studies. So Brian Galvin spoke about policy and research perspectives on substance use. He spoke about a knowledge bridging event that took place in November 2023. When he put up 2023, it was that long ago, because I was actually there, and it was absolutely brilliant half day of people literally coming out of their offices, coming out of their silos, meeting others, and there was a real sense of openness and people finding common ground and discussing that topic of drug use and finding how relevant it is across so many different departments and fields and academic fields. I could feel a sense of there being a gear change in the room that day. And Chris spoke to us about evidence to implementation, a case study on GP services, which is fascinating, that ongoing work. Chris also offered insights into how to create the perfect policy bicycle by prioritising delivering on time and using the imperfect data. Minister Dr. Jennifer Carroll McNeill eloquently shared her thoughts about and support for research, and she spoke about how research not only has its own intrinsic value, but its value also lies in the impact it has on people who live here, and that we need evidence for many reasons. It has a huge value to society, including the ability to extend lifespans and quality of life, to improve how we age, and we need it to be able to use medicines and resources and change practices to meet the needs of the people who want to grow well and to grow old with dignity. So I thought that was very well put. Session 3 was about the enablers and constraints that are required to embed evidence for policy into organisational structures and routine practices. Sorry, I had to read that one, that was a long one. And Marisha O'Connor just chaired that one. And we heard from Anastasia Delacourie, who spoke about the Joint Research Centre, or JRC, which is a scientific arm of the European Commission, a research hub for Europe. As an aside, about 15 years ago, I got to visit the JRC at ISPRA, and I got to go on a press trip just to see what they do there. And looking back on it, I felt like Charlie Bucket getting the golden ticket to go to the chocolate factory, because it was just the most amazing, inspiring place, such a place of collegiality and just interesting research. If you ever get a chance to go to a JRC, go. Because you have disciplines working there together, as Anastasia told us, for the best decisions for policies and the best policies for societies. And they're both proactive and reactive, which I think is really interesting. They underpin the full policy cycle. And she spoke about how we particularly need evidence when we're setting the policy questions. And Anastasia also told us about the frameworks and tools and training to help build the skills and mindsets needed, because ultimately it's people who are doing the research, it's people who are sharing the research, it's people who are building the policies, people who are benefiting from the policies. But we also need to understand the limits, that policies should not be evidence-based, but evidence-informed, that it's a democratic process, and that's a really important point. And then Stefan spoke about ensuring evidence feeds into effective interventions, good practices from OECD countries, and the trust survey showed that there is a direct link between evidence and decisions and a perception of trust in government. But, of course, it happens in the messy world of politics, and healthcare in particular has both huge economic and social implications, and with that comes enormous levels of emotion. So Stefan spoke about the importance of evidence not only for policies in healthcare, but also for strategies views on decisions and clinical practices. And some lessons learned from analysing OECD countries: we need to invest in competencies and capacities. We need to strengthen public engagement, that's one close to my heart, and we need to invest in cognitive approaches. This is where you have insights into people's behaviour and attitudes to risk, and to identify disinformation. We also heard about the importance of systemic approaches, so things like aligning institutions and behaviours, investing in governance and strengthening trust. Trust was a word that kept coming through in this discussion. And to remember that trust and reputation are easily broken. So perhaps things like general declarations of any conflicts of interest would be a good idea, and making sure people who are at the local level interacting with citizens have really good information as well. That can help to build trust. And as Stefan told us, it is a joint effort, and we need to promote sharing, create those closer links between all parts of the elephant, as it were. Or maybe it's about having a good set of nuts and bolts to keep the bike together. So that is a really sort of whistle-stop tour of what we heard today. And we're going to move into a panel discussion now. So I'd like to invite our panellists to come up to the stage, please, and join me for a chat. And don't forget, Slido is still on, so please do put your questions up. I think we might have a roving mic. I'm not sure. I'll be corrected on that, but certainly Slido is probably the easiest. So if you have your questions for our panellists, please do put them up, and I will do my best to ask them all. Hi. Thanks, Mel.
Oh, are there enough?
This is where I seamlessly transition to the other mic. Thank you so much. Amazing. Have we got another? Oh, no, do you know what, John? You sit down. No, seriously, I'll stop. It's okay, sorry, I miscounted the chairs there. Great, thanks so much. Okay, so I'm just going to very briefly introduce our panellists, one of whom you've heard speak already today. That one is Dr. John Lavis, who's Director of McMaster Health Forum in Canada. Next we have Dr. Teresa Maguire, who's Director of Research Strategy and Funding at the HRB. And then Dr. Jennifer Brennan, who's Research and Innovation Strategy Lead at the Department of Climate, Energy and the Environment. And Professor Mary Horgan, who's Interim Chief Medical Officer and Professor of Infectious Diseases at UCD at the Mater and the Mater Misericordiae University Hospital. And Mary, I understand you have a hard stop. You may need to leave us before the panel discussion ends, which is no problem at all. Just wanted to flag that. First of all, maybe if I could get from each of you a few of your insights from the day. I mean, you heard the whistle stop there. Was there anything that stood out for you particularly today? John, I might start with you on that one.
Sure. So, I love the metaphor of the Formula One pit stop, because I think that's what I imagine the future will look like. You'll be going around the track, you'll pull in one business, in my world it's one business day there, you have a couple of seconds, fix the tires, put the gas in, give people what they need, they go out again, and then they come back the next time, and then you can fix them up again. So I think that's the culture we're aiming for. And everything that Leonora described to me is putting in place some of that culture, but we also need that culture of the pit stop. Second quick thing would just be the enablers. So Barbara commented on the need for a repository for the commissioned local evidence, but I would just say, and Stefan mentioned this, that evidence synthesis infrastructure collaborative is going to be the best evidence from around the globe that you can quickly pull down. And some of it's already there. If you work in climate solutions with the Destiny Project, every climate solution study in the world all sitting there ready to be pulled down. And the final one, capacity. This world has moved more in the last year or two than it has in the previous 30, this world of supporting evidence-informed policymaking. So I think we have a role to play in meeting with the executive leadership teams. We've done that in many governments in Canada, saying in 30 minutes, here's how far this space has moved. Here's the new ways you should be setting expectations for staff. So those would be three things: culture, enablers, and capacity.
Very good, very good. Yeah, I do like the pit stop idea because there's speed as well.
Yes.
Speed, efficiency, bam, bam, bam,
yep.
go.
And go.
Absolutely,
yep.
Great, thank you. Teresa.
Maybe make one reflection, I think. I mean, I know this is the Health Research Board conference and we're talking about health and social care, but I think, and it'll be expanded on in a second, I think what's really clear, no matter what country people are coming from, no matter what policy area we're talking about, actually what's really, I think, promising, and I'm very optimistic about it, is actually, if this was a focus group in terms of, what we needed to do, I think, we've hit saturation. That's that makes me optimistic, but I think we also have seen today some very practical solutions. Some of them at an early stage, some of them tried and tested, some which are, perhaps sound game-changing. But I think there's a pathway to take this forward. And I think the one thing that I suppose we realise, certainly even sitting in healthcare, is that when we sit across government, and COVID showed this, health is in all policy areas. So whether we're talking climate, whether we're talking the One Health agenda, I could just keep going on and on, whether we're talking about the life sciences strategy. It's really, really helpful that we're now starting to talk a common language across government departments, across the research community or communities of communities. And I think that's something that's really striking today that I don't think I would have heard maybe even 2 or 3 years ago.
That's
definitely
a big
not
cultural
5 years
change.
ago.
So it's a big mindset.
It's really, really resonating for me today.
That's great. Jennifer.
Great, thanks. I think the one thing that's really hit home for me today is the importance of good quality evidence synthesis and the capacity to do good quality evidence synthesis. And I was extremely impressed by the work that John presented, and also hearing about our colleagues from the Department of Health and the work that they're doing there, the interface with, and I see there's a question there about the HRB Evidence Centre and its expertise. And that's something I think as a department, we are extremely keen about getting good quality evidence to underpin the work that we do across climate, energy and the environment. And within those 3 areas, we have a huge breadth of responsibility. It's a huge policy area. And at the moment, I would say we don't have in-house capacity to do that kind of evidence synthesis work. And so as part of our own research and innovation strategy that we brought out last year, we're thinking about how we fill that gap. Do we do it in-house? Do we work with our agencies? Do we try to work more closely with higher education institutions as they start to build out their capability and their knowledge brokerage and evidence synthesis as well? So that's really what jumped out for me today. And also, I was the person who asked the question about AI in the first session. So that's also something for me today, I think, that's come up, is how we can harness it in a really practical way, maybe to try to fill some of that gap.
Yes.
As well.
Yeah. I'm sure we'll come back to that as well. Mary, how about you? Any standouts?
Yeah, I'm just going to pick up on that. I think John's talk, the second talk, brought out the robustness of evidence synthesis and the rapidity of AI. And for that and we need to embrace it, means change for people. I am a big fan of evidence synthesis hubs. For those in the audience who know me, I suppose have seen the health sector from different areas now, but the importance of really understanding our evidence synthesis ecosystem within the country, because different groups have different talents. And there are gaps and overlaps, and identifying those so that we really get value for money, but also value for the fantastic people who work in evidence synthesis. And the last thing in Stefan's talk, he spoke, really, it's not always about health. We can make policy decisions that seem perfect for us, but the input of a multi-dimensional look at what we do, because not all, there's other socioeconomic impacts that things like a pandemic have on us. It's not all about the health of the person or population, but about the other influences in our society that lead to a healthy population. So they're the three things.
Brilliant, thank you. Important. Thank you all. We have, the questions are already flooding in, so that's wonderful. There's one specifically there for you, John. Do we know what good evidence looks like done quickly? Is there consensus on what this looks like?
Was this Declan? Declan, was this you? This question for me, what does good enough look like? This sounds like something you and I discussed yesterday that you were interested in pursuing. What Declan and I were saying is there are no, I don't think, agreed norms here. I think there are a lot of people doing this. How do we get you the best evidence in whatever time you give us? And we're all trying to do our best and saying, okay, we'll deliver this. If you give us another 5 days, we'll add more bells and whistles. But what the right bells and whistles are for those different time periods isn't agreed by these diverse folks. So I think right now through the Evidence Synthesis Infrastructure Collaborative, we have these opportunities to bring together these evidence intermediaries from around the globe, look at our different practices, and over time ask the question, should we have more harmonization, but also where might we need variance because of local political context, other things.
Exactly. Great, thank you. We might go back to, we saw during the pandemic that the public was discomforted sometimes by rapid decisions and rapid changes. Might public trust be adversely impacted by rapidity? Just speaking to that myself, as a journalist, pre-COVID actually, I think it was 2019, I was at the European conference or the World Conference for Science Journalists, and what everybody was talking about there was that we need to convey more about the process of research and science and how it's done, so that people do understand that when the evidence changes, the guidelines changes and the practices change, and it's not just happening. The fact was that COVID, it happened very quickly because it was a rapidly evolving situation, but it was possibly a lack of insights about the processes that were going on behind it that may have contributed to that sort of gap in trust, maybe, into which other things flowed. So I'd be curious to know what the panel thinks about that question. You know, rapid decisions and rapid changes, can that erode the hard-won trust that we want to keep? Mary?
I think, the pandemic, I suppose, is a good example. In the beginning of any pandemic or health threat, I'll talk about infection because I'm an infectious disease doctor, there's a lot of uncertainty. And I think it's okay to be, this is about communication with the public and understanding behaviour and behavioural response. I was really glad to see in some of the talks about the importance of behavioural science in it. I think once you communicate as much as you can with the population as to how decisions, the process by which decisions are made, that you base it on the science at that particular point in time, so that when people retrospectively correct everything that they felt we should have done at the time, that there's always a caveat. This is the moment in time, this is the science we have, and these are the reasons we made the decision. But to me, it's about absolute communication, I'm speaking from a department point of view, up to the minister and into cabinet, but down to the operational arm of our health service, the HSE, but really, really importantly to the population. I think we're fortunate in Ireland. We have a really educated population that get it, and I think if you communicate, you can bring them along in the journey. But rapidity sometimes does need to happen, and I think we could be more rapid in a lot of the decisions we make, because science changes all the time, and if you're really 12 to 18 months doing evidence synthesis, by the time you get to the 18 months, whether it's the drug or something, the drug has got cheaper or whatever. So.
Did you want to come in?
Well, just to say that, and I think we learned this lesson during COVID. I hope we never have to relearn it. Context shift, issue shift, evidence shift, and we need to communicate that with humility to people. Things will evolve, and I think one of the evidence innovations that really came online during COVID was living evidence syntheses, where as the context shift, as the issue shift, as the evidence evolved, the evidence syntheses were being updated in real time. And that will soon become the new normal, that we'll be able to turn to these living evidence products and in a moment in time say, what is the Irish specific contextualized message that we can take away from this now? And we all have to know that when we come back in 6 months, it may look a little bit different. But we need to have the humility to recognize that. And to your point, Mary, we need to be able to communicate that to the public.
Absolutely, absolutely. And I assume that AI is a huge game changer in being able to do that. So maybe we can talk about that for a second. I mean, Jennifer, AI is something that it can be very helpful, but is it practical to use it when you're working in an environment where you're developing policy? Are there barriers to it?
So there are barriers to it now, as in the people that work in my department are actually not allowed to use AI in any way. There are public guidelines out there, but they're about developing an AI and how you would go about developing an AI. So, for example, if you worked in the Department of Social Protection, you might be trying to develop a new way of processing claims for disability allowance, for example, to do that much more rapidly. In my own setting, people are not really supposed to use AI, and I'm saying not really because I think people do. And there is a danger there. I think we do need to, not just a danger around, and I mentioned AI hallucinations and it giving you weird results, but actually a danger in people understanding how to use it properly. in that. And I suppose go back to the earlier points about evidence synthesis and having, I suppose, a well-resourced evidence capability or unit within all government departments that understands how to use these tools, is trained appropriately and resourced appropriately to do it, instead of having a free-for-all of every civil servant having ChatGPT open and on their phone and doing things. Yeah.
Right. So again, it comes back to skills and resources and things like that. Yeah, absolutely. Let's see, there are lots of other questions. It seems clear that there's a need for an independent, well-resourced knowledge brokerage entity or organisation in Ireland. How do we get there? We heard about the success of the one that Brian talked about with the HRB and the IUA that worked so well as a case study. How do we kind of scale up on those kinds of successes? Any thoughts?
I might say that I think maybe when we say an entity, I don't know that we'd necessarily get to an entity or an organisation. I think what we might try to get to is consistency of approach. So if we had in every university, institute of technology, maybe state research organisation, maybe the health service, a similar kind of office or organisation, and have those offices working together in a network or a community of practice so that they can share learnings and so they all do things in a relatively similar way. Obviously, some institutions will have a slightly different bent than others. I think that would be good. And then similarly on the civil service side, to have some sort of consistency of approaches to where this, the responsibility for this is located. And then if we can create the bridges between those organisations, I think that would work really well. I don't know that we'd get to the point where we would set up a kind of a knowledge brokering Ireland kind of office, although perhaps maybe the Campus Engage office of the Irish Universities Association, if appropriately resourced, could maybe fill that gap in some way.
Teresa, did you want to say something?
I was going to say along the same lines. I think at this point, I don't think that I would jump instantly to thinking of an organisation or an entity. I do think there are people in this room that would walk around and I would see them as a knowledge broker. They probably don't see themselves as a knowledge broker. I think the more we talk about this and people kind of identify that some of their role is that we acknowledge that we acknowledge the importance of it. And I think at organisations at all levels, whether that be within funders, whether that be within evidence producers, definitely within the department, I think that is important. I think another point I would make is that I think knowledge brokerage happens at different levels. I mean, I suppose that's just something that has struck me. The more we're engaging as a funder, I think the HRB are pretty unique in some senses that, you know, the Venn diagram that you threw up earlier of the research support system and the evidence support system. I don't think we really had the language on it, but I think we have been supporting the evidence support system for many years. So we're kind of like a funder plus, but it has brought us also, as witnessed by the very good, I think, dialogue and relationship between our department and us as their agency. The more we've moved into that space and really start to put evidence for policy under the bonnet, I think there's department-wide knowledge brokering, you know, we've talked about the statement of research priorities or the areas of research interest. Like, there's a brokering that needs to happen around that. There's a methodology around that. There's an approach to do that and to do that well and to do that at a frequency that the minute you walk out the door with it under your arm, it's not already out of date. Yeah. That's really, really helpful for long-term guide and signalling to research communities, to early career researchers and to the research community on the supply side. And then there's the, I suppose, the more time-bound windows that we've really been talking about here today, where somebody has a problem or they need a solution, they need to understand something. Then there's brokering at the question setting, the where do we get it, and then when you have it, what is it telling us and what do we do with it piece. So it's knowledge brokering as a term is something that for me, I actually tie myself up in knots about, because I think the context, the purpose, the use and the time window within this. So I think lots more to think about in that, but I think it's really, really great that we're talking about knowledge brokering. We're talking about the capabilities and the skills and the competencies of knowledge brokers. We're talking about knowledge brokers distributed in all sorts of organisations, not in any one. And I think then it's a job of work to try and put some sort of, there's definitely some sort of structure or coordination or something on that.
Informal network. Yeah. You're formalising the informal network so that everybody can access it, not just the person that you went to college with or you worked with back in 2008 or something. Okay, great. Let me see. Oh goodness. Okay, how can the HRB? I think we may have already visited that one. What's one concrete change would you like to? Oh, hang on, it's moved. That you'd like to see in how policymakers commission and use evidence by this time next year. So there's a deadline. What concrete change would you like to see in how policymakers commission and use evidence by this time next year? Any thoughts on that, Mary?
Okay, 1 year deadline. I think it's knowing who's out there and what they're doing. I mean, that should be a fairly, it's mapping who's out there. I think we underutilise our international networks. There's no point in us doing, our face masks, good or bad. I mean, we know other people are doing it. So I think we need to dip in and partner, collaborate. What we do, knowledge exchange with other partners internationally. We heard from some of them today, and particularly within the EU. So what can we get from them? What can we give to them? I think they're fairly straightforward things that we can do at an early stage. And obviously, there's always kind of, well, if we fund some of those, but I think it's knowing what we have within the country, optimizing the skill sets, because some people do behavior, some people do HTAs, other people do rapid live synthesis, and then going outside the other system to see how we can really strengthen our global relationships with knowledge exchange. And I don't think that costs a lot.
No, that's more about attentional awareness, isn't it? And sort of, yeah, absolutely. Jennifer, any thoughts on that? I'll come to you next time.
Yeah, it's a very tough question. I think what I would love to see is for all the policymakers in my department to know who they should be talking to and have the channel to be able to talk to them. So having an understanding. So if they're assigned to work in a policy area like land use, that they understand who the key researchers in Ireland and internationally are in this area, and particularly in Ireland, that they have a way to be able to discuss and meet with these people when they need to.
Great. And would you see that as being creating the channels or creating fora where people are busy, they have lots to do all day, and if they have to use part of their brain and their bandwidth to kind of go, oh, well, I need to ring, Mary McGrath down in Kerry about this. That's whereas if there were regular fora where people got together, maybe they'd naturally be meeting Mary McGrath.
I think it's a little bit of both, to be honest, Claire.
Yeah.
I think we probably do need fora. We need to, and part of my role in the department is to try to create those opportunities for people and organise events where they get to meet with people. Mm-hmm. But I think also we do want to get to the stage where they are able to approach and they feel comfortable.
And they're done with that purpose as well of that, that knowledge brokering. Great, good stuff. John, did you have thoughts on the concrete thing?
Yeah, well, I guess it feels like a year is more than enough time to say every department should be able to say what their pit stop is. Where do you go when you have a policy question and you're trying to mix and match to the relevant forms of evidence? So what are the best sources of evidence out there for that type of evidence that you're looking for? Who are the best researchers in Ireland that you want to help involve in contextualizing the process? That seems to me to be low-hanging fruit. And to build on Mary's point, it's partly about mapping. And then you need people who can hear the policy question and say, oh, okay, well, do you realize that every synthesis in the world about how to strengthen health systems is all sitting in one place, all quality appraised. It's called health systems evidence. For goodness sakes, go and use it. Yeah. Did you realize that in Ireland you have these 3 leading health systems researchers who can help to contextualize that evidence, but also put the local Irish studies along the way? So just that mix and matching approach, I think that's a realistic expectation. Yeah. Know your pit stop by the next year, and if it doesn't exist, create it.
Create it, exactly. And we already saw in Leonora's talk as well about, a lot of that mapping has been done around the place now as well. So it's making people aware of it. Yeah. Teresa, any thoughts on that concrete change in a year?
Yeah, I think I would echo John's point and say, actually, we have pockets of really, really good practice and evidence where that does help. And certainly, from our perspective in the Health Research Board, in terms of working with the department, where we try to, see the policy questions or the knowledge gaps coming, and you're trying to support turning those into research questions that we might put out to the community, which I think makes sense. And it's a really, really key role that funders can really help with, because, we have databases of who the people are, what they do, and so on and so forth, which, which is really, really helpful. But I think in that particular situation, the conversations that you have, as often somebody says, well, we have this policy issue, or we have this policy area. Have you funded anything in that in the past? We go and take a look, we see, have we funded in it? We haven't really. Why is that? Are we not getting the applications, or are we getting the applications and it's not quality? We can then, either look at capacity there. We may not be able to deal with the issue through doing that, but we can start looking at capacity in the forms of evidence and incentivize things in those areas. We can see that there are evidence reviews out there that could help to answer the question, and maybe we don't need to be thinking about going and doing primary research. We know about international colleagues, and I suppose what I'm saying is, it's happening informally and in an ad hoc way. And expect conversations, relationships, and dialogue, and use people who are multipliers. And it's not all about funders, but a funder in this instance, an agency of a department, is a multiplier, because you know who's who, where's where, what's happening, and you can find it out very, very quickly. It doesn't mean you can resolve the whole issue, but you can certainly, deal with that up front. And we've had those situations where we're saying, well, actually, it is a capacity building initiative that we need to do, find elsewhere. Or actually, the evidence is there already, let's synthesize it quickly and give it to it. Or actually, let's go out to the research community to take that forward. So I think it's about trying to put a bit of structure, and that's the norm, rather than individual-led or policy unit-led. Sure. I think that is eminently doable, I think, and definitely within a year, and fits with everything that we've talked about here today. And I think is regardless of a department at all, I think that's the way to do it. I mean, I can't imagine, again, having sort of spent time coming from a research background, and when I worked in the Department of Health, you just don't have the time to be looking on websites around all of the universities and individual researchers and looking up their publications and so on. So if there are networks, if there are professional bodies, if there are membership groups and so on, if you've got a funder or a contact in that space, use them for those purposes. So I think we just need to think about that a little bit differently. Sure. We all have roles beyond what we think our stated roles are as organisations.
And I suppose as well, I mean, just thinking about the different types and timelines of research as well. I mean, John, you were talking about things, being turned around very quickly in a couple of days, and then more bells and whistles, etc. So I presume that you need that big kind of reservoir of evidence out there, don't you? So what's the importance of, maybe we're thinking today about that phone call comes in, from a policymaker to a researcher and says, I need this evidence, but what about the longer term, that longer burn of evidence? How can funders support that? Teresa, maybe?
Yeah, I think it's really, really key, and it was the point I was going to make, because I know I was watching some of the questions earlier, even saying, well, look, even if we're involved in evidence synthesis, is it all now about 3-day evidence synthesis, and does that mean, it's kind of not valued anymore? And then I know some of the other questions kind of saying, well, what about all of the other types of evidence and the things that take 2, 3 years, 5 years? And I think we won't, to earn the right to be talking about rapid products and evidence synthesis and evidence for policy, we have to have a good hygiene in our research and innovation ecosystem. We have to have a long-term view as well as a very, very rapid view, and everything in between across all those forms of evidence. We've seen today, we build capacity. We think we're building it for the research system. Somebody will become the minister. They will become a regulator. They will become a clinical lead. They will become the CMO, or whatever the case may be. So we're actually planning forward, both in terms of the capacity, in terms of people, in terms of the forms of evidence. I think an important thing from our perspective is always investing in methods and process innovation. And I think that's not really talked about enough. But if we don't have people from an early stage and throughout the system who are thinking, how do we do these things better, smarter, describe the limitations, contextualize this piece and so on. So I think that's really, really important. And culture in the research system is going to get you a long, long way there in terms of the evidence support system. And by that, I mean open research, open science, open data repositories as the norm, thinking about the participants, the diversity and inclusion in your research. Remember, the research outputs are what are going to be taken up by AI in the blink of an eye into the evidence products. Co-creation, a culture of co-creation. So we're not just having an evidence product at the end thinking, how do we get the patient voice into this and do. Actually, if the research from the start is done co-created with knowledge users, with public in patients.
And this goes back to something
it's
Infectious
just
said as
really,
well,
really
beginning of the
important that
policy
we're
development.
doing that and bringing those voices into the research system. And just the final point, I suppose, I would make, we talk a lot in this space about how bringing researchers and policymakers together can be challenging, and they're so different. Bringing researchers together, even within the same institution across disciplines, but certainly bringing them together. So I think that was a learning for us during COVID as well, that actually researchers needed to come together and get over themselves in some sense, and put institutional and other things down. So I think investing in research networks that at a minimum bring researchers together to cross-fertilise, to challenge one another, to get used to working with one another. If you're doing that, you're definitely going to be in a better place to engage in dialogue with policymakers and practitioners
always helps when you're bringing
others. So
researchers together.
I think the focusing on the research, it'll always be a research system and the interface with the evidence support system. And I think it's really important that as a funder at the table that we say that. And I suppose also with colleagues from the Department of Mind, there is a danger that as we talk more about evidence for policy and short-term decision making, and we are talking about the Ministry of Health, from a health perspective, we're talking about evidence for policy and practice.
Yes.
And that's everything from trials to longitudinal studies to all these, and to early career researchers. So it's important that we have always are investing and supporting a blended portfolio with a long-term outlook, with a short-term outlook for the research system hygiene and also for this. So I think I just want to throw that in today because I know we're focusing on evidence for policy, but that itself sits within a broader system.
It does.
And
And John,
helps the other.
you wanted to come in there briefly?
Well, just quickly, I don't want anybody to misunderstand my focus on the evidence support system and meeting policymakers' urgent needs today with not also supporting a really robust research system.
Yeah.
One connection between the two is how do we systematize the feedback loop? So when we go out and we pull together, what do we know today to meet policymakers' needs today? We have feedback loops into the research community saying next generation research should tackle topics like this. It should use designs like this that will give us more informed answers next time. So systematizing those loops so the 1, 3, 5 year long research studies can have even bigger impact.
Fantastic, fantastic. Well, listen, we are coming up on time, so huge thanks to everybody involved in today's conference, and thank you so much to our panellists, to John, Teresa, Jennifer and Mary, and thank you all for your fabulous questions as well.